addictions is gripping our province stronger today than it has ever before. We're seeing not only an increase in the number of people who suffer with addiction, but we also see an increase in crime being committed as a result of that.
How you doing?
I'm feeling so good.
What's going on?
I just feel like I'm dizzy. I'm blacking out a bit.
Were you using by chance today or anything like that?
No.
Addiction is a disease. It is a chronic disease. It's a chronic illness.
We're gonna have EMS come and check you out, okay?
Harm reduction is very important for people dealing with addictions.
Harm reduction is acknowledging that addiction is a disease and it's a very hard to treat disease. And sometimes meeting a patient where they're at means allowing them to engage in their addiction in a safer way.
We will manage them with some other medications so you can come off slowly.
Once somebody's dependent and hooked on to a drug, there's going to be a different way their brain mechanisms work. There are different connections in the brain. So very few patients who've been addicted for a long time can go drug-free.
I think I'm ready to get everything under control.
Perfect. So harm reduction is a way where we can have them use opioids under supervision.
Hi, Cassie.
Another example of harm reduction would be a safe injection site. So having a place where a patient can get clean needles in order to inject to at least reduce the risk of infectious diseases like HIV and hepatitis C.
I think sometimes people feel uncomfortable with that dialogue because it seems counterintuitive. We want to stop people from doing drugs, and yet you're giving them the tools to do them, and you might in some cases be providing a safe environment for them to do them. Well, guess what? If you're addicted, you're going to do it anyway. Harm reduction is an acceptance that, number one, we have a problem, and number two, while we're trying to tackle the problem, if we don't do something to reduce risk to those that are addicted, then we're going to lose lives.
Let's suspend judgment for a minute and assume that someone uses a needle and they throw that needle in a school playground. Would you as a parent want that needle to be there, not there, clean, not clean? So if we sort of looked at it that way, I would prefer that that needle was clean. I would prefer that that patient never even had to do that in the park or was able to put that needle somewhere safely. We're reducing that amount of transmission, and so we're keeping the health of the community front and center of what we're doing when we talk about harm reduction.
We have needle exchange programs in the province. We've got inhalation kits that we're giving out. We're giving out naloxone kits to help reverse the effects of some drugs if those ill effects are posing a health risk to someone.
So, Jesse, you've expressed some interest that you wanted to learn how to use a take-home naloxone kit. Harm reduction to me means anything that we can do as a society to mitigate harm associated with drug use and misuse. So I'm just gonna briefly show you how to use that kit, okay?
Harm reduction makes sense from an economic point of view as well. Keeping people safe while they are using drugs helps to prevent disease like HIV and hepatitis C. So it saves the healthcare system money.
So when you went through detox in the past, did they offer you any treatment programs or anything like that?
If you can get somebody started on a harm reduction program and they're doing well on it, there's less chances of them having overdoses where they end up in hospitals and taking up the time and the beds that it takes for them to be there.
Do you drink any alcohol?
Yes.
You need to understand the economic benefits of doing it that way, but we also can't lose sight of the individuals. It can't just become a numbers and stats game. We also have to look at it on a personal level and the difference we're making in people's lives.
And then when I stop taking pills, it gets harder and harder and harder.
I think it's so important for all people in healthcare to advocate for people with addictions and to advocate system-wide for changes that need to take place.
A multidisciplinary team in dealing with clients with addictions should comprise physicians, nurse practitioners, social workers, physiotherapists, pharmacists. I think everybody needs to be available to the patient at any given time.
There are two medications that I would typically recommend. Let's put a lot of our efforts in prevention, early detection, early treatment and management of patients before it gets serious to the point where we're dealing with overdoses.
If we really want to take a bite out of crime, if we really want to enhance community safety, we have to dial it right back to the root cause of it, which is the addiction, and find a way to help people through their addictions.
There's no time to waste. If we really want to save lives, we need to get front and center of this thing, and we need to do it together.